Hi, my name is Cindy Castillo. I am here to present my Quality Initiative project for Nurse Leadership and Management course for Nurse Class 4502. A little bit of background, I am an emergency room nurse. I am currently employed with Uvalde Memorial Hospital, and I chose to discuss sepsis and use that as my Quality Initiative project for this course. So according to the World Healthcare Organization, sepsis affects more than 30 million people a year, and it could lead to 6 million deaths a year. So what is sepsis? Sepsis is an infection that invades our body. It's resistance to antibiotics. It originates from anywhere, lungs, urinary tract, foreign medical device, and creates symptoms. The symptoms that have to meet criteria when you walk into an emergency room are as follows. And I also have this information that is in my PowerPoint, so feel free to go back and utilize that. So our SIRS criteria, which is systemic inflammatory response syndrome, and you'll have to bear with me because these are hard to look at, and there's probably glare. But the SIRS criteria, and I'll just go over the main topics to get to my project. So SIRS criteria, any of the two of the following: a temperature greater than 38.3 Celsius or less than 36 Celsius, heart rate of greater than 90, so our patient would present tachycardic, respirations of greater than 20. And so what would happen when someone presents to our ED with some of these things and maybe has a potential UTI or pneumonia? So what we do at Uvalde Memorial Hospital is we initiate a sepsis management bundle. And we have criteria that has to be met that is also met nationally by, there is a sepsis campaign that was initiated, a sepsis awareness campaign that was initiated in 2012. And it has criteria. Every year it's updated based on evidence-based research that's done. Sometimes things are increased or decreased, just depending on the criteria and the evidence. So what do we do? Within an hour, any of these patients that meets our SIRS criteria, we have to initiate lactic levels. We have to order blood cultures and administer IV broad-spectrum antibiotics that are approved by the NP that's working in our emergency room. If a patient is hypotensive, we need to initiate vasopressors and fluid resuscitation. So without going into too much detail about that, we'll talk about that. So what we do at Uvalde Memorial Hospital is we have our core measures, and we have a quality initiative nurse, Linda Galindo, and she works with other departments, and they put information together and get scores for us. So my project and things that I looked at were our quarterly measurements. So for 2018, we had a total of 178 patients, and out of those 178 patients, each quarter, our first quarter, which happened to have been our lowest score, was 54% that we correctly met our sepsis management bundle. And so, and the highest score, which was in the middle of that, was about 94%. So what I would like to see would be that each quarter we have greater than 75% for each of our patients that comes into our ED or that's admitted into our hospital, and those numbers are incorporated as well, inpatient, outpatient, and have those numbers greater than 75% for the fiscal year of 2019. So how would we do that? So, and again, my PowerPoints are the timeline and budget, and I'll go over that in just a moment. But some of the things that we missed were we delayed treatment, or we initiated things before treatment, after treatment was initiated. So for example, sometimes we gave antibiotics before the blood cultures were drawn, and sometimes we failed some of our hypotensive patients. They did not receive adequate tissue perfusion. Most of them only got a liter of bolus, and they actually required a little bit more. And some other misses were assessments and reassessments that need to be done by our physicians, and we have criteria that has to be met as well. So, and I'm reading these off here from the bullet that I made. So our physicians need to, if we have to repeat volume and tissue perfusion assessments, they have to complete vital signs and cardiopulmonary exam. They have to do cap refill evaluations and peripheral pulse evaluations and a skin exam. This has to be done by the MD or the PA, and the reassessment has to be done if this patient meets these criteria. If not, we fall out of our markers, out of meeting our benchmarks. So what I would like to incorporate would be a budget, and we have a quality initiative nurse, which is Linda Galindo, and she takes care of our numbers and our core measures. But I would like to also incorporate a SWOT analysis RN that would also work with her and get the information that is obtained. We analyze our data and maybe have an education team and pull in those that were involved when we missed our measures and have them refocus and regroup and possibly come up with feedback. So initiate some type of program that would have them give us feedback as to how to correct the measures, not as a source of scolding or to point fingers, but just as a way for us to get better, so that we meet our markers and that we improve our health care and our quality of care for our patients. So that budget that would be used would be the salaries for these two RNs, guessing over $100,000. And the plan of action would be the education, the analysis, the reanalysis, and the feedback markers from individuals involved. So I hope that you enjoyed my quality improvement initiative, and I hope that I am more involved at our hospital. This actually sparked an interest in the department that I work with, and I have to give respect to those that do work in this field, that collect data, because this has definitely been a hard class, and I hope to improve. I hope you have a great day. Thank you.